I'm Lauren. I'm a student nurse. Is it okay if I observe you today?
Absolutely.
All right. Can you give me a report on your patient?
Yeah, I'm about to go into room 619. This is Glenn Light. He has no allergies. He is a full coach. He has diabetes mellitus type 1 for 20 years. He has a stage 2 diabetic ulcer on his right heel for 3 months now. For 5 days, his capillary blood glucose has been over 300. His neuro assessment was his pain since the ulcer on his foot was out of 6. He is alert and oriented times 4. He has low anxiety. He is able to ambulate on his own. And for his respiratory assessment, he was clear. His lungs were clear. They were even and effortless. He is on room air, and his O2 stats were at 95%. His cardiovascular assessment, his cap refills are less than 3 seconds. His pulse was regular. His radial pulse was 2 plus expected, and pedal pulse. He has no murmurs, no edema. His heart rate was 80, blood pressure 145/72. And he has an IV in his right forearm, right medium forearm. And his GI assessment, his abdomen was flat. He has active sounds in all 4 quadrants. He is on a 1,800 calorie diabetic diet with 2 grams of sodium restriction. And he has brown stools. And his capillary blood glucose at 1645 is 209. So for his GU assessment, he is, like I said, he can void by himself. His urine is yellow and straw color, so it's normal. He has full ROM. And for his skin, so again, his IV is in his right forearm median, and he has a stage 2 diabetic ulcer on his right heel. And
Okay. I might have a couple other questions before we go in the room. Why specifically is the client receiving the insulin?
So because he is a type 1 diabetic, his body is unable to produce insulin on its own, so we have to make sure he's getting that when we administer insulin.
And what's the action of insulin?
So the action is to transport to the cell so the glucose is transported to the cells.
Okay. When should you question administering the medication? And does the medication have a therapeutic serum level?
Yes. So the serum level is 70 to 120.
Okay.
And I would question administering any insulin to him if he was under 120, I would want to hold. If he was above 300, I would want to call his physician.
Okay. Are there any interventions that need to be taught to the client to ensure the medication is administered safely in the hospital and also at home?
Yes, so we want to make sure that he is always checking his blood glucose. We want to make sure that he is switching sites, and we want to explain to him like the diet, make sure he's eating when he administers the insulin.
Okay. What are the side effects of insulin?
So the side effects for insulin are he might become sweaty, disoriented, confusion, headaches, nausea, vomiting.
How will you know the medication's effective?
So we would know if we're going to keep checking his capillary glucose levels and make sure it's working by the numbers, if it's in a therapeutic range or not.
Okay. Well, that's all I had. I'll follow you into the room so you can give the insulin.
Let's go see Mr. Light.
Okay.
Come in. Hi, Glenn. My name's Ashley. I'm your nurse today, and I brought along a student nurse, Lauren.
Hello.
Hi. Can you tell me your last name and date of birth?
I'm Glenn Light, 67 years old.
Perfect. All right, so I'm going to give you your insulin today.
Okay.
Wash my hands. Are you in any pain right now, Glenn?
No, not right now.
All right, and have you been eating your meals when they come up?
Yes, my lunch should be on its way.
All right, perfect. All righty, and When you administer your insulin at home, do you alternate your sites at all?
Sometimes.
All right, so we need to make sure that you are always alternating sites. You never want to continue to give yourself your insulin in the same site.
Okay.
And are you aware of the symptoms of hyperglycemia?
No, what are they?
All right, so if you become hyperglycemic, you may get a headache, nausea, vomiting, might get blurred vision.
Okay, thank you.
You're welcome. All right, so do you have a preference where we give your insulin today?
The nurse earlier gave it in my right arm.
All right, so we'll go ahead and do your left arm. Okay, so I'm gonna get his insulin out of here. Get my alcohol wipes ready. And I'm gonna type in his patient ID. Alright, so we're gonna go ahead and get his medication out of the Pyxis. And can you tell me your name and birthday?
Glenn Light, 67.
And do you have any allergies, Glenn?
No, I do not.
Alright, so now we're gonna go over here and match it up to the Lamar, make sure we got the right med,
Right click on the med.
right person, right route, expiration date, and it is next year, February 2018. And now we're going to go ahead and, because I don't have a scanner, I have to type it in.
Okay.
So if you want to go ahead and read me the number on his armband.
Okay. It's 771-8154. And it should be Glen Light, he's 67. Okay. So this is D9B, C98, EB 983651. Is it this number? It's not the mouth worker number. It's this number over here.
Yeah, the
barcode. That's what, because we've been using this number the whole time.
All right. Well, can you read me that one?
Okay.
Sorry about that.
650-255-5339.
All right.
And we're getting the
Green light.
That's the one you will.
17.
Someone else is going to get it.
And I want to put his CBG at 1645. Was 290. And I'm just going to go ahead and say I'm administering on his left arm. Initial. So I'm going to go ahead and get my syringe out. And he's going to be getting 6 units today. So we're going to go ahead and pull up 6 units of air. And we're going to go ahead and clean the top of the insulin here. I'm going to push here. And then we're going to draw 6 units back. Verify. All right. And so we're going to go ahead and recap here. Okay. And then, so again, I want to just make sure we have the right medication, right dose, right route. Expiration date is February of 2018. Okay. Okay. So now we're going to actually go ahead and administer the medication. So I'm going to go ahead and wash my hands. My gloves. Alright, and can you tell me your name and birthday and
Light, 67.
Thank you. And do you have any allergies?
Nope.
All right. We're going to go ahead and give you your insulin in your left arm.
Okay.
Go ahead and clean your arm. And point it down there.
Is that good?
And I'm going to go ahead and pinch the side. Poke. At a 90-degree angle. Push the medication in. Hold for 5 seconds. Make sure it all gets absorbed. Pull out. On the sharps. All
Very
right.
good, Ashley. It didn't even hurt a lick.
Good. We'll be here. So I'm going to go ahead and see. All right. Wash my hands. Okay. Do you have any questions for me now?
Were there any pertinent pieces of information that you reviewed before administering them?
Yes, so we always want to make sure we check his sugar, make sure we're not going to over-medicate or under-medicate. And we always want to make sure that he has in fact eaten or has food coming before we give the meds.
Okay. Does information affect how you would administer the medication?
No, not right now. I mean, again, we just want to always make sure that his sugar is not too high or too low. We don't want to put him in hyperglycemic or hyperglycemic.
Okay.
Okay. All right, and now we can teach him. So, Glenn, at home, we always want to make sure that we do what?
Change our sights.
Okay, and can you tell me again, if you are hyperglycemic, if your sugar is too low, what you may feel?
I'll be sweaty, clammy, I might have a headache, and maybe some nausea, vomiting.
Perfect. All right, and do you have any more questions for me?
I don't.
All right, well, I'm going to go ahead and give you your call bell here, and you can make sure you call us if you feel any of those symptoms, and we'll come in and take care of you, okay?
Will do.
Perfect. And then I'm going to document the teaching in the mark on the
Okay.
computer.
I'll come up to you.
All right.